How to treat sleep apnea naturally. Snoring isn't something that most of us worry about. But loud snoring, especially when it's accompanied by daytime fatigue, may be a sign of sleep apnea, a common and potentially serious disorder in which breathing repeatedly stops and starts as you sleep. Untreated sleep apnea can be dangerous and detrimental to your health, so it's important to see a doctor if you suspect that you or a loved one might have it. Read on to learn the warning signs of sleep apnea, how to distinguish it from normal snoring, the medical treatments available, and what you can do to help yourself. Sleep apnea affects the way you breathe when you're sleeping. In untreated sleep apnea, breathing is briefly interrupted or becomes very shallow during sleep. These breathing pauses typically last between 10 to 20 seconds and can occur up to hundreds of times a night, jolting you out of your natural sleep rhythm. As a consequence, you spend more time in light sleep and less time in the deep, restorative sleep you need to be energetic, mentally sharp, and productive the next day. The chronic sleep deprivation that comes with sleep apnea results in daytime sleepiness, slow reflexes, poor concentration, and an increased risk of accidents. Sleep apnea can also lead to serious health problems over time, including diabetes, high blood pressure, heart disease, stroke, and weight gain. But with treatment you can control the symptoms, get your sleep back on track, and start enjoying being refreshed and alert every day. Types of sleep apnea. Obstructive sleep apnea is the most common type of sleep apnea. It occurs when the soft tissue in the back of your throat relaxes during sleep and blocks the airway, often causing you to snore loudly. Central sleep apnea is a much less common type of sleep apnea that involves the central nervous system, occurring when the brain fails to signal the muscles that control breathing. People with central sleep apnea seldom snore. Complex sleep apnea is a combination of obstructive sleep apnea and central sleep apnea. Sleep apnea signs and symptoms. It can be tough to identify sleep apnea on your own, since the most prominent symptoms only occur when you're asleep. But you can get around this difficulty by asking a bed partner to observe your sleep habits, or by recording yourself during sleep. If pauses occur while you snore, and if choking or gasping follow the pauses, these are major signs that you have sleep apnea. Major signs and symptoms of sleep apnea. Loud and chronic snoring almost every night. Choking, snorting, or gasping during sleep. Pauses in breathing. Waking up at night feeling short of breath. Daytime sleepiness and fatigue, no matter how much time you spend in bed. Other warning signs and symptoms of sleep apnea. Waking up with a dry mouth or sore throat. Insomnia or nighttime awakenings. Going to the bathroom frequently during the night. Forgetfulness and difficulty concentrating. Uncharacteristic moodiness, irritability, or depression. Morning headaches. Restless or fitful sleep. Impotence. Signs and symptoms of sleep apnea in children. While obstructive sleep apnea can be common in children, it's not always easy to recognize. In addition to continuous loud snoring, children with sleep apnea may adopt strange sleeping positions and suffer from bedwetting, excessive perspiration at night, or night terrors. If you suspect your child may have sleep apnea, consult a pediatrician who specializes in sleep disorders. Once obstructive sleep apnea is diagnosed, surgery to remove the child's tonsils or adenoids usually corrects the problem. The following strategies can help you decipher the symptoms. Keep a sleep diary, record how many hours you're spending in bed, any nighttime awakenings, and whether you feel refreshed in the morning. Ask your sleep partner to keep track of your snoring, including how loud and frequent it is. Also ask him or her to note any gasping, choking, or other unusual sounds. Record yourself sleeping. Taking a video or audio recording of yourself while you sleep can be very informative and revealing. You can use a sound-activated audio recorder, a video camera, or software that turns your computer into a recorder. Keep in mind that even if you don't have sleep apnea, a snoring problem can get in the way of your bed partner's rest and affect your own sleep quality and health. But there are plenty of tips and treatments that can help you stop snoring. Sleep apnea causes and risk factors. Anyone can have sleep apnea, young, old, male, female, and even children. However, certain risk factors have been associated with obstructive and central sleep apnea. Risk factors for obstructive sleep apnea. You have a higher risk for obstructive sleep apnea if you are, or have, overweight. Male. Related to someone who has sleep apnea. Over the age of 50. Black, Hispanic, or a Pacific Islander. A smoker. High blood pressure. A thick neck circumference greater than 15.75 in or 40 centimeters. Other physical attributes that put you at risk for obstructive sleep apnea include a deviated septum, receding chin, or enlarged tonsils or adenoids, the most common cause of sleep apnea in children. Your airway may be blocked or narrowed during sleep simply because your throat muscles tend to relax more than normal. Allergies or other medical conditions that cause nasal congestion and blockage can also contribute to sleep apnea. Risk factors for central sleep apnea. Like obstructive sleep apnea, central sleep apnea is more common in males and people over the age of 65. However, unlike obstructive sleep apnea, central sleep apnea is often associated with serious illness, such as heart disease, stroke, neurological disease, or spinal or brainstem injury. Self-help treatments for sleep apnea. While a diagnosis of sleep apnea can be scary, it is a treatable condition. In fact, there are many things you can do on your own to help, particularly for mild to moderate sleep apnea. Home remedies and lifestyle modifications can go a long way in reducing sleep apnea symptoms. However, they should not replace medical evaluation and treatment. Lifestyle changes that can help sleep apnea. Lose weight. People who are overweight have extra tissue in the back of their throat, which can fall down over the airway and block the flow of air into the lungs while they sleep. Even a small amount of weight loss can open up your throat and improve sleep apnea symptoms. Quit smoking. Smoking is believed to contribute to sleep apnea by increasing inflammation and fluid retention in your throat and upper airway. Avoid alcohol, sleeping pills, and sedatives, especially before bedtime, because they relax the muscles in the throat and interfere with breathing. Exercise regularly. As well as helping you to lose weight, starting and sticking to an exercise program can have a major effect on the duration and quality of your sleep. Aerobic and resistance training can help reduce sleep apnea symptoms, while yoga is also good for strengthening the muscles in your airways and improving breathing. Avoid caffeine and heavy meals within 2 hours of going to bed. Maintain regular sleep hours. Sticking to a steady sleep schedule will help you relax and sleep better. Apnea episodes decrease when you get plenty of sleep. Bedtime tips for preventing sleep apnea. Sleep on your side. Avoid sleeping on your back, as gravity makes it more likely for your tongue and soft tissues to drop and obstruct your airway. Some people only experience sleep apnea when sleeping on their back. The tennis ball trick. In order to keep yourself from rolling onto your back while you sleep, sew a tennis ball into a pocket on the back of your pajama top. Or wedge a pillow stuffed with tennis balls behind your back. Prop your head up. Elevate the head of your bed by 4 to 6 inches, or elevate your body from the waist up by using a foam wedge. You can also use a special cervical pillow. Open your nasal passages. Try to keep your nasal passages open at night using a nasal dilator, saline spray, breathing strips, or a neti-pot. Tighten the muscles that keep the mouth closed. Try chewing gum or holding a pen or a pencil between your teeth for about 10 minutes before bedtime, or until your jaw starts to ache. Alternative remedies for preventing sleep apnea. Singing can increase muscle control in the throat and soft palate, reducing snoring and sleep apnea caused by lax muscles. Playing the didgeridoo, native Australian wind instrument, can strengthen the soft palate and throat, reducing daytime sleepiness and snoring in people with moderate sleep apnea. Sleep apnea treatment. If your sleep apnea is moderate to severe, or you've tried self-help strategies and lifestyle changes without success, it's important to follow up with a sleep doctor who can evaluate your symptoms and help you find an effective treatment. Treatment for sleep apnea has come a long way in recent times, so take some time to explore the new options. Even if you were unhappy with sleep apnea treatment in the past, chances are you can find something that works and feels comfortable to you. Treatments for central and complex sleep apnea usually include treating the underlying medical condition causing the apnea, such as a heart or neuromuscular disorder, using supplemental oxygen while you sleep, using breathing devices that will also manage obstructive sleep apnea. Other breathing devices for sleep apnea. In addition to CPAP, there are other adjustable airway pressure devices that a sleep specialist may recommend for sleep apnea treatment. Bilevel positive airway pressure, BPAP, devices can be used for those who are unable to adapt to using CPAP, or for central sleep apnea sufferers who need assistance for a weak breathing pattern. This device automatically adjusts the pressure while you're sleeping, providing more pressure when you inhale, less when you exhale. Some PAP devices also automatically deliver a breath if it detects you haven't taken one for a certain number of seconds. Adaptive servoventilation, ASV, devices can be used for treating central sleep apnea as well as obstructive sleep apnea. The ASV device stores information about your normal breathing pattern and automatically uses airflow pressure to prevent pauses in your breathing while you're asleep.